So for general medical information, I wanted to go over heat illness prevention and treatment of heat illnesses. So to prevent heat illnesses, you want to have the athlete wear loose-fitting clothing or moisture-wicking clothing. You want to ensure that they are properly hydrated. That means drinking at least 20 ounces of water 2 to 3 hours before the exercise occurs. You want to have the athletes monitor their urine color. Ultimately, the lighter it is, the more hydrated that they are, and just watching this to make sure that they are properly hydrated. And then you want to make sure the athletes are acclimating to the weather. So that means you want to make sure that the athletes are moderately increasing their activity level and the intensity at which they are performing the activities when they are doing so in excessive heat, just to make sure that their body can ultimately acclimate and so that it doesn't cause any heat injuries or illnesses. Next, I want to go into treatment. There are four main types of heat illnesses that I will tell you how to treat. The first one being heat cramps. This is a minor injury. You want to use stretching or massaging wherever the muscles are cramping, and you want to promote hydration. Then you have heat exhaustion. With this one, you want to make sure that rehydration is emphasized. You want to cool the person with ice bags or cold towels, and you want to ultimately get them out of the heat. There's also heat syncope. This is where the person ultimately faints. You want to elevate their legs to return blood flow to their heart. This will ultimately help them in the long run. And you want to move the person out of the heat and get them rehydrated. Lastly, the most severe heat illness or injury is heat stroke. With this one, you want to cool the body with water and ice immersion, ultimately within 10 minutes. If you are able to do it within 10 minutes, this has an 100% success rate. This means the person will most likely not receive any fatal injuries or anything like that. You then want to call 911 because, like I said, heat stroke is a very serious heat illness and can ultimately cause death and organ failure. So with all of these treatment methods and prevention methods, athletes should be fine working in the summer.